What is heart failure? So heart failure basically means that the heart isn't pumping as effectively as it should be, which means if the ventricles aren't pumping the blood through the body, then the body starts to become weak and the tissues start to be deprived of their nutrients.
This is what a normal heart should look like. And this is what a heart with heart failure looks like.
So these are some different types of heart failure. You have right-sided heart failure, which is the inability of the right side of the heart to push blood into the pulmonary vascular system to become oxygenated. And actually left-sided heart failure can cause right-sided heart failure. And then you have left-sided heart failure, which you have systolic and diastolic. Systolic is called reduced ejection fraction, which means that the heart is not able to generate enough force to perfuse the rest of the body with blood. And diastolic means that there's not enough relaxation of the ventricles to allow the heart to fill with enough blood. And here are some causes of each. Here are some general symptoms of heart failure. So we're going to show you cyanosis of her fingernails. You can see that they're blue tinted, whereas compared to her other hand, these are nice and pink.
Oh, I'm really tired. I think I need to take a seat.
Heart failure patients are often easily fatigued.
Heart failure patients often experience frequent urination due to fluid overload.
Coughing is oftentimes a symptom in heart failure patients. I'm also going to auscultate her lung sounds. You often hear crackles and wheezing when auscultating a heart failure patient's lung sounds.
All right, can you tell me what year it is, you think?
1998.
Okay, confusion and mental status changes are common symptoms of heart failure.
So when should you call the doctor? Here are a couple bullet points as to what you should look for before you call the doctor. Most importantly, monitor your weight. If you gain 2 to 3 pounds in one day or 5 pounds in 1 week, that's pretty important. Swelling in the legs, feet, or hands or abdomen, that's also something to really look for. And also a hacking cough and difficulty breathing while lying down are key symptoms. When should you call 911? Here are some key symptoms as to when you should call 911. Chest discomfort or pain that lasts more than 15 minutes and is not made better by resting or taking nitroglycerin. Also, if you can't catch your breath, you're fainting or passing out, or if you have a fast or irregular heartbeat. These are key things that you have to call 911.
One of the things that can happen with heart failure is fluid buildup in your veins, which can back up and leak into the tissues, into the extracellular space, and that is called edema, or just swelling is the common term. And you'll see that often with heart failure.
So there's pitting edema, which responds to pressure, leaving an indentation even after you remove the pressure. And here's an example of that.
She has 4+ pitting edema on her foot. And as you can see, if you come in close, you can see right here the type of edema. See how it's leaving a mark? Okay, and in the other foot, you can see it does not have any swelling. So you can definitely see the comparison when you touch the foot with the swelling.
And then we have non-pitting edema, which does not leave any indentation. The foot will look, there will be no indentation after you press on it. And here's an example of that.
So as you can see, you can push in and it kind of see the swelling and
So
stuff.
why does this matter? This is important because chronic pitting edema can be a sign of liver, heart, or kidney problems, as well as symptoms of problems with the nearby veins. And then non-pitting edema often indicates something dealing with the thyroid or lymphatic system. In congestive heart failure, fluid can start to build up, causing leg edema. If this fluid continues to build up, it can also go to your lungs. And then if you have right-sided heart failure, the fluid can get to your abdomen, otherwise known as ascites. When treating edema, the first priority is identifying the underlying cause, in our case, heart failure. This edema is often treated using a diuretic, which causes you to pee more. This then allows the fluid from the legs to flow back to the blood. Another way to help kind of treat this is by reducing how much sodium you eat.
So, for a patient with heart failure, it's important for them to weigh themselves daily and document any fluctuations in the weight. Daily weights, although simple in ideation, must be done in specific ways.
When taking daily weights, it is important to do it at the same time, in the same clothes, and using the same scale. It is recommended that you do it without shoes on, and you should wear the same thing as mentioned each time you weigh yourself, or nothing at all. The best time to weigh yourself is in the morning after you go to the bathroom.
So we came up with an easy way for you to remember that. So we have an acronym that's SATS. So that means to have the same situation. So weighing yourself after you wake up in the morning, after you go to the bathroom, and before you eat breakfast. And then the A stands for apparel. So wear the same clothes every time you weigh yourself, so that the clothes aren't a factor in the weight. So do it at the same time of the day. We suggest in the morning, and then use the same scale because certain scales can measure differently.
It is important to weigh yourself daily because changes in your weight can indicate fluid buildup, which also can indicate that your heart failure is worsening. So it's important to wear the same clothes to minimize them playing a role in the weight change. So it's important to use the same scale because each scale can be calibrated differently. There's a study done by Curtis et al. Found that when taking the numbers from a bed scale and comparing them to results from a standing scale, there's conflicting data. Chart audits revealed that there was a 25% change in weights. So weighing yourself after using the bathroom gives you more accurate dry weight, which is how much you weigh without fluid.
Okay, so this is an article about the association between regular symptom monitoring and patients with heart failure. So it's a study that was done. Half of the participants had regular symptom monitoring, which was daily weights and lower extremity edema, and then the rest didn't adhere to this. So it kind of shows the difference between the outcomes and the complications that came with the people who didn't adhere to their regimen for taking daily weights and monitoring for symptoms. So this relates to our project because we talked about how if patients monitor for these symptoms, then they'll have better outcomes for their heart failure.
So there are cultural differences that should be considered when planning a heart failure patient's care and the monitoring of it. So different cultures will handle their disease differently. Some cultures might not even want to trust medical advice or healthcare professionals, and they might not want to adhere to the regimen. So the calendar is a way for them to monitor their fluid status without going to a healthcare professional frequently, like weekly visits to monitor their fluid status. African Americans are also at a higher risk for high blood pressure, which can eventually lead to heart failure. And we have also included different units of measurement because certain cultures use pounds where other ones will use kilograms.
Health literacy is a key topic when it comes to heart failure, so we try to focus on that a lot with our teaching tool. So a lot of patients with heart failure are older adults, so they might be less health literate than others, and they can have altered mental status like confusion, dementia, things like that, and also they can have a hard time hearing. So it's important to make sure that they understand. And so other considerations we took with our project, other than using simple tools and simple terms on the poster, we offered several different methods. So like suggesting apps for some patients, like we try to use pictures, graphics, and mixed media because that tends to help people understand things more fully. This is an article that we're using in our presentation. It's from the American Heart Association, and it's regarding health literacy and how that relates to cardiovascular disease and cardiovascular problems in the United States. So a lot of patients have low health literacy here in the US, and we saw that especially with our heart failure patients. And so our teaching tool is aiming to make it simple and easy for heart failure patients to monitor their symptoms, understand their condition, and what can make it better and worse. And this is how we can make interventions like this accessible to all people regardless of their health literacy level. So this article is just talking about how the low health literacy is affecting patients with cardiovascular disease.
So these are some contributing factors of heart failure. So the first one is high blood pressure. So if you have uncontrolled high blood pressure, that means that your heart has to work harder, which will eventually lead to heart failure because it's been working extra hard all that time. An irregular heartbeat, lung disease, alcohol, an infection, high sodium intake, which that high sodium intake will lead to high blood pressure, which will then lead to heart failure, a heart attack, and also diabetes.
Managing your heart failure might be a little difficult, so we decided to download a heart failure tracking app to see how it will work and see what it does for the patient. Right here you can see some pictures screenshots that we took, and it tracks your pulse, mood, and other things that you can see on the screen. It takes your time to take the medicine, daily mood, symptoms, vitals, appointments to doctors, daily activity, sodium guidelines, and water intake. This can be used for people who are used to using apps in their smartphone. It can be an easy central location for all of the information that you need to know about your disease and tracking your progress.
And these are our references.
Hi Ashley, how are you doing?
I'm good.
Hi, what's your name?
I'm Elise. I'm Ashley's daughter.
Oh, nice to meet you. So as you know, Ashley, you're being discharged soon today. And we're gonna give this to take home with you. This is gonna help you take control of your heart failure. It's a chart here to write down your daily weights and the changes that you may see from day to day. And as we've been telling you, that is a sign of fluid changes, which is related to your heart failure. So I'm just gonna explain it here. If you have any questions, just stop and ask. When you're stepping on the scale, remember to use SATs. It'll help you remember to use the same situation, which is like, we recommend in the morning after you pee or after you have a bowel movement, so that it's just dry weight, not extra weight on you. Same apparel. Some people like to do it like right before they step in the shower. Don't do it after the shower because you'll be wet.
Okay.
Or just wear the same thing, like underwear, t-shirt. Just wear the same thing every time. And then time, you want to make sure you do it at the same time each day so that it doesn't fluctuate based on the time of day. And same scale, because some scales can have changes in their calculations. So just on the chart we have your weight, they just write down quick every day, any changes from like the previous day, and then just notes, symptoms, signs, or any like differences that you, like if you eat more salt, that may affect your weight. So just write down whatever you think is important.
Got it way off the burgers, Mom.
And then you will take this to your next doctor's appointment and we can look over it and see how you're doing.
Okay.
Do you have any questions?
Not at the moment.
Should we keep this somewhere specific in the house, or what do you
I think
recommend?
I think it would be helpful to keep it somewhere that you see every day so that you remember to do it. I think it's best
Like in the
on the
bathroom?
mirror. Yeah, somewhere in the bathroom, near the scale, near the shower. So you see it as you're getting in the shower. Somewhere to remember to do it every day.
Alright, sounds good.
Okay, so this is to demonstrate the correlation between your weight changes and fluid gains. So when you gain about 4.5 pounds, that means you gained 2 liters of fluid, because each liter of fluid is equal to 1 kilogram, which is about 2.2 pounds. So double that, about 4.5 pounds is equal to 2 liters of fluid. This much right here. So if you gain 4.5 pounds, you've got this much extra fluid in your body that your heart has to pump, and it's making it work harder. So we're going to demonstrate the weight gain. So we'll weigh you first without the extra weight. Okay, you are 117 pounds. Now you can step up, or actually stay there. I'll hand you these 2 liters of fluid. And then we'll reweigh. Alright, now it's at 21.5 pounds. Extra fluid really shows up on a scale. So measuring your daily weights is really important to monitor your fluid.